Now, if you go through history, what's some of the either cures or management of sleep apnea? And of course, the first one that came out was in the 80s, about 100% cure. You do a tracheostomy. You bypass. That's what they were doing with a lot of the morbidly obese people because they didn't really have any other way to do it. And then you've got CPAP came on the scene about 1981. It's management. It has about a you know, it, the effectiveness is about 95% plus, maybe even 100%, but about 48 to 50% of the patients don't wear it properly, effectively. And the interesting thing is success is defined as 4 hours a night for really only 4 or 5 days a week. So they're not wearing it all the time. And then the oral appliance therapy, or the other is maxillomandibular advancement surgery with genioplasty. It's almost a cure when you move the upper jaw forward and the lower jaw forward and the chin with the tongue attached forward. Everything's coming forward, not backward. You pretty much can cure sleep apnea. So these two are about the cures, but nobody really wants to do the first one, even the second one. You got oral appliance therapy, which is what we deal with. You get a high cooperation level, but it's not quite as effective. But its success is different. 8 hours a night, 6 days a week is kind of the definition of success for that. So the goalposts are different here. Effectiveness increased with a thing called matrix system. Dr. John Rimmers invented this. It's something it's auto titratable, kind of a temporary oral appliance that's auto titratable during the polysomnography to come up with what is the best mandibular position, the vertical plus the anterior posterior position of the mandible. And probably the best thing, if you can ever get it covered by insurance, is a combination of CPAP. CPAP blows the air it blows the air open with air, but the oral appliance physically dilates the airway. So sometimes I've got people that really have a great success with that. Steve Carterson came up with this. I hadn't really heard about this, but there's about 1.7 million PAPs sold in the United States. 820,000 of them are abandoned. So the success rate's about 52%, 48% of them are abandoned, and there's only about 110 claims for EO486, which is the oral appliance for sleep apnea.